This presentation demonstrates the technique for gel sonovaginography. Gel sonovaginography delineates vaginal and cervical lesions better than the conventional transvaginal sonography alone. It is an easy technique to learn. For me, gel sonovaginography is like the telescope to assess vaginal and cervical lesions. Now let's look at the items we need. For gel sonovaginography, preferably a new bottle of gel so as to avoid air bubbles. But in many places, that is not readily available, and we rely on refill containers like we have here. I prefer transparent containers, the non-transparent one, because you will see what you are doing in real time and avoid areas of air bubbles while withdrawing the gel into the syringe. That is not possible with non-transparent containers. You need a pair of disposable gloves. You can use either a 10 or a 20 ml syringe. The original description by Mala Sibel used 20 mils, but I use 10 mils and the results are comparable. That also has some economic advantage via practice. You need a condom or a prop cover. You need to clean the patient after the procedure using either baby wipes or serviettes. Now, these are the steps for gel sonovaginography. An assistant holds the container upside down, and then the syringe is introduced into the container. Most importantly, it is the barrel that is pushed over the plunger and not the plunger pulled over the barrel as is the conventional practice. Then the gel is deposited in the posterior fornix. Now let's look at the video. Here you can see the assistant holding this refill container upside down, and note this technique. I am pushing the barrel over the plunger, not pulling the plunger. This minimizes the risk of air entry into the syringe. Here you can see that the syringe is well lubricated in this environment of gel. Then with the right hand in the vagina, guide the syringe using the left hand between the index and middle fingers of the right hand. Now withdraw the right hand, advance the syringe, and gently deposit the gel in the posterior fornix. Then withdraw the syringe. Then apply a few mils of gel into the condom and dress the transvaginal pop and start the examination. Examine the lower parts before moving upwards, because air bubbles will form with time and blur the image quality. So, procedure is completed. Gently withdraw and respectfully clean the patient. Longer duration of scanning would lead to increase in air bubbles, which also affect the quality of the image. If there are air bubbles that makes it difficult to visualize the area of interest, do not repeat the procedure during the same sitting, because the clarity will not improve. Give the patient another appointment. So now undress the prop, at the same time clean the prop using baby wipe as shown here. Then remove the glove one after the other as shown and discard. The procedure is contraindicated in pregnancy and in active vaginal bleeding. Now, this video demonstrates what not to do before gel sonovaginography. If you pull this way, and push, you have already introduced air into the syringe, and therefore this syringe should not be used for gel sonovaginography. Get another one, otherwise the image quality will be poor. Thank you very much.